Hello, everybody. I have a very special guest today, Dr. Anna Garrett. Welcome to the show, and we're so excited to have you.
Thank you. I'm very happy to be here.
So, first of all, could you please give us a little bit of an introduction about where you grew up and where you went to school and how you came to the pharmacy profession?
Oh gosh, how long do we have? So I am a native North Carolinian. I live in Asheville right now, but I grew up in Greensboro, and I went to the University of North Carolina 3 times, not just once. I have a degree in accounting from the first trip around the block, and then I got a BS in pharmacy and then my PharmD. Um, I came to the profession of pharmacy because I was actually working in marketing for Domino's Pizza. And I essentially had gotten as far as I could go with the franchisee that I worked for in Greensboro. And my husband at the time was a pharmacist. And I had lots of friends that were pharmacists. And I was like, well, this seems like a pretty cool job. And I had intended to work retail and just work part time. This was in the I don't know, this was in the late 80s, when, it was really easy to find a job doing exactly what you wanted to do. So I went to pharmacy school and met somebody when I was on rotation who told me about residencies. And she was in the PharmD program and I was in BS. And I was like, that sounds really interesting. And so I ended up doing a hospital pharmacy residency. I created my own job as my residency project in infectious diseases and stayed there for, I don't know, 7 more years. And then I've kind of branched out into different things from there, but I just kind of got into pharmacy by accident.
Wow, yeah, what a journey. You don't hear about that kind of journey from anyone. Like usually for me, I went into a straight 0 to 6 program and I was kind of locked in there and I was like, all right, like this is my first choice. If I don't like it, I'll transfer out. But you never hear about people trying to like transfer in, and especially doing a residency, that's a big commitment.
Yeah, and doing a residency with a BS. I mean, back then, PharmD programs were not the entry
Right.
degree. It became that way while I was in the BS program. But yeah, so fortunately, I knew the residency director at this program I wanted to go to, and it had not been accredited yet. And so I just called him up and said, hey, I want to come do this. And he was like, well, just apply. So I did. and that was that. And so it was a really big tertiary teaching hospital that has a great reputation. And so I feel really lucky to have gotten in on the ground floor without having to go through a whole match program and all of the drama and stress that people have to go through now to get a residency.
Yeah, that's amazing. Good for you. And you never know until you try, right? So you just went.
Exactly.
I love infectious diseases myself, mostly because, you can actually find ways to treat and cure people rather than have it lingering as a chronic condition. So I think that's,
Mm-hmm.
a really great field. So how did you then go from this field and branch out into other things? Like walk us a little bit through your trajectory of your career.
Well, it's certainly not been linear. When I decided to leave the hospital, I went to work for Merck as their HIV specialist in North Carolina. And
Wow.
very quick, yeah, HIV was kind of my thing. And that was back when, people were still actually dying of HIV and all of the new meds were coming on board. And so I did that. And 6 months into it, I was like, yeah, I don't think I really want to do this. So I went to work at a small community hospital as a staff pharmacist and um, got to know one of the oncologists there. And he worked for a very large physician group. And they wanted to start a clinical pharmacy program. And so he took me out to lunch one day and said, hey, you want to start this ambulatory care pharmacy program for us? I was like, sure, I'll do that. Not having a single day of ambulatory care experience in my life, but I'm all about a good challenge. And so we started out with a co-ed clinic, and then I grew that to, we were in 2 cities, 6 practices. We had 4 pharmacists and a dietitian, and then it was time to move to Asheville. And so I left that behind and became the manager of outpatient clinical pharmacy services at Mission Hospital here, which included the co-ed clinic, the disease management program, and medication assistance. And so I did that for about 3 years. And in that time period, I did a coach training program. We actually put our care managers in disease management through part of the program. And I enjoyed it so much that I finished the entire certification. And in 2011, I knew I wanted to start my own business because I wanted more freedom and flexibility. And so I put together my business now, which is dr.annagarrett, and it's a virtual online business. And I work with women who are going through perimenopause and menopause, and offer a variety of functional medicine services designed to help them balance their hormones and basically achieve the best health that they can.
Wow, that is such a great field, and they're so
Yeah, I
lucky
love
to
it.
have you and your expertise, because it seems like you did it all. And actually, a lot of the people that I have as guests on the podcast, they're pharmacists that just like say yes to everything
Yeah,
and try
that's
all these
me.
opportunities and then end up just starting their own thing and consulting. And it's so great to see that.
Well, it's scary, but it just, I'm the kind of person that wants to be able to kind of call my own shots. And so the idea of working for somebody 40 hours a week for the rest of my career just was like not appealing. And I knew that women in that age range were not being served well by the traditional medical community. And so I knew that I could have an impact on them and for them, and to help them, feel as good as they could possibly feel going through that transition. And it is a very, it's less underserved now, but it's back then there was like nobody who was working online, and women were really frustrated with the care that they were getting from their doctors. And it's, it's not the doctor's fault. They just don't get trained. And so I teach them how to advocate for themselves within the medical community, and then also have services that are available that they can access.
Great. So how did you come to specialize in exactly this field? I know you said because you saw the standard of care was lacking, but is there anything else that made you want to serve this community? And how did you start from that first coaching program that you had? How did you then expand into functional medicine approaches and advocating and things like that?
Well, I chose that area for 2 reasons. Well, 3. I was my ideal client at the time. I knew they were underserved, and I knew that they would pay cash for the services. And so to me, that was a really logical place to go, because from a marketing messaging standpoint, it was kind of like talking to myself.
Yeah.
So that makes it, a lot easier if you can really relate to who your ideal client is. What I've found over, I've been doing this for 10 years now almost. What I found was that I really wanted to be able to serve my clients in a broader and deeper way, because they weren't always getting the outcomes that I wanted them to have just by doing hormone testing and, using supplements and changing their lifestyle around. And so that led me to the School of Applied Functional Medicine. And I don't really know how I stumbled across that. Somehow the founder's a video that she did landed in my inbox, and I watched it and I was like, oh, this is really cool. So I started that in, I guess it was 2018, and I just started the second semester in the last couple weeks. And so that is allowing me to really look at a broader scope of health for my clients. And I really enjoy it, because you might have guessed by now, I get easily bored with things. And so, doing the same thing over and over again was just not, I mean, it's rewarding, but it's not, it doesn't really tease my brain as much as I like to have it stimulated. So this has been a great addition to my practice.
Yeah, they say that people who get easily bored are the perfect, you know, they possess the perfect trait to become a successful entrepreneur, because you get to wear many different hats and you have to wear them in order to tackle everyday problems. Just because you have your own business to allow for freedom and flexibility doesn't mean it's an easy job.
Oh, no. Well, and there are things that I'm just not good at. I mean, like the technical side of things, I'm not good at it. I'm never going to be good at it. And so, I hire people to do those things for me because the learning curve and the amount of frustration I would encounter along the way is just not worth it when I, know people who are able to handle that sort of thing for me. So I think that's an important thing to be aware of on your entrepreneurial journey, because I know a lot of pharmacists, some of the ones I've coached, I help pharmacists start businesses from startup. And one of the things that I think pharmacists get caught up in a lot of the time is feeling like they have to be perfect at everything. But really, I mean, your skill set can't be everything, unless you're superhuman. And so it's about knowing when to outsource and when to pull back and know what your genius work is. And, what is it that only you can do? The rest of it can be taken care of by somebody else.
Yeah, absolutely. That's great business advice, because a person who's running the business needs to have like their personality and their gifts out there, and messaging to the people about it maybe. But then you can have a marketing team, you could have an IT team, and you could have like a whole team to do what you don't need to personally do, and outsource those things to make it more cost effective and more profitable.
Well, and even with an accounting degree, I have a bookkeeper and a CPA because I would rather do anything than sit down and try to figure out QuickBooks. So just not going to do it.
Yeah, you figure out also what you enjoy doing so you can outsource the stuff that you don't enjoy doing so much.
Exactly.
So tell us a little bit about how you went from, the idea of leaving a 9 to 5 and starting your own thing to actually putting that plan in action, and whether you quit cold turkey or whether you faced your workout.
I did not quit cold turkey. I started out just kind of building the business very slowly. And so I knew what I wanted to offer. And then it's like my first client was my trainer. And she had had a hysterectomy years before and was having a lot of issues with hot flashes and stuff. And so I said, look, if you buy the test kit, I'll do the interpretation for free. And I don't recommend doing work for free anymore, but that's how I did it. And so she was my first client, and then my best friend was my second client, and then I was my third client. And so that's kind of how I built it up. But I stayed employed PRN in the Coumadin clinic at the hospital. So the department I actually used to run, I ended up working in. But it worked out great because the whole staff was women, and they were all of childbearing age, and I was not. And so it was like the ultimate in job security. So I worked 2 to 3 days a week. And then in May of 2017, I decided that I really, I could step away from that and just focus on one thing. So I think, some people think that it's either an all or nothing thing, and it really isn't.
Yeah.
You can start slow and then build along the way.
So how do you actually conduct an appointment session? And do you typically recommend like a package deal, or maybe you have a whole program for people to complete, or do you do like also PRN appointments when needed?
Yes. So the thing so everything is pretty much a package, and you can't do the PRN appointments unless you've already been a client and been through one of the packages. So I have one package that is hormone testing, and there's an intake, and we do the testing, we get on Zoom, and I do the review with them, and we go over their plan, and then we do a 6-week follow-up with that, and then from there we can do an ongoing coaching relationship if that's what they need, or they can do PRN appointments. And then I have a much bigger package that's 6 months long that looks at hormones and gut health and nutrient deficiencies. And so what else does it have in it? Oh, genetic interpretation. And so it kind of covers the waterfront of everything that I could possibly want to know about somebody. And then I also have an account with Ulta Labs. So if I need blood work and they live within driving distance of a Quest center, I can get blood work. And for that, we talk twice a month, and I create a very customized plan for them that we implement over that 6-month period. And then at the end of that, if they want to continue our work together, we do that.
Awesome. So how do you actually, besides them mailing out the blood test, what are the other ways that they could give you those hormone tests and other tests that you may want to examine?
So I use the Dutch test, which is a dried urine test, and basically it's done in home and they send it to the lab. The GI map test is also an at-home test that they send back to that company. The SpectraCell test does require a blood draw, so they have to take it to, I haven't done one yet, so I'm not sure where they have to take that. But anyway, and then the genetics, I basically take somebody's raw 23andMe data and run it through a proprietary system that I was trained on. And we look at areas like nutrition, genetics, sleep, supplementation, detox, athletic performance, and hormones. And so I give them, it's an 80-page report, which I do send them, but I also do like a 2-page summary of what really stands out, and then the changes they can make to either turn up the good genes or dial down the bad ones. So we incorporate all of that and create a personalized wellness plan.
Awesome.
So it can all be done at home, pretty much.
Yeah, that's a real benefit. They could do it themselves, and then you guys get together for a visit virtually.
Mm-hmm.
Great business model for nowadays too. You don't have to leave.
Exactly. And I've been doing it for 10 years, but so I've taught my weight loss class in Hawaii before, and I've done consults in Costa Rica, and so it's great for me.
Wow, that does sound great. So what do you find to be like a common theme or a trend among your patients when you examine like the blood work and other tests that you may want? Do you find that the tests are, a priority for your toolkit, or do you find that the symptoms are enough in some cases to recommend lifestyle or dietary changes? And so as far as the figuring out the problem,
Mm-hmm.
do you figure that the tests are, very an effective tool for you, or could you maybe make do without testing in some cases?
I can. I'm pretty much, I lean toward the test, don't guess side of things. But just being in the School of Applied Functional Medicine, I can now take somebody's basic wellness labs and look at them and go, oh, this is not, it's in the normal range, but it's not in the functionally ideal range. And, create a plan from that. So it really depends on what somebody's budget is. And there are people who just want to see the data. They know that something is off. They've been to their regular medical doctor and been told you're normal, and they have, they trust their bodies and know that something is not normal. And so I basically will take anything that they have already from a lab standpoint and go ahead and look at that, and then decide from there based on their symptoms and what I'm seeing, what the next best step is. So somebody doesn't have to jump all the way into, doing all the testing. There are obviously budgetary constraints for people around what doing those labs costs. But I will say at Ulta, I don't know if you're familiar with them or not, their pricing for blood work is just amazing. So like a vitamin D level that costs $200 at the doctor's office, $29 at Ulta. So
Wow.
it's really a nice setup for people, especially if they're uninsured.
Yeah, absolutely. Sometimes you want to go for that service, even if you do have insurance.
Yes, exactly.
Yeah. So when we were talking about the hormone testing, are you generally looking at estrogen, androgens,
Mhm.
progesterone, or do you also do thyroid or any other kind of adrenal, maybe hormones?
Yeah, so all of the sex hormones, the androgens, the estrogen, progesterone, and then the Dutch test, the reason I like it so much is because it shows the metabolic pathways that the client's body prefers for elimination of those hormones. Um, it also does a really deep dive into cortisol and then also organic acids for some of the B vitamins, glutathione, and then 3 neurotransmitters as well. So it's a really nice picture of how it all fits together and what can be manipulated to get the outcomes that the client is seeking. Um, for thyroid, I need blood work for that. So there are some things that can be inferred from the Dutch test, but it doesn't have any specific thyroid numbers. So I can do that one of two ways. Ulta Labs has a thyroid panel that they can get, or I can send them a blood spot test kit from ZRT. That's who I use if somebody needs blood spot testing. So I have an account with them as well.
Great. So in summary, you find the testing to be really helpful in
Mm-hmm.
coming up with a plan for the patient.
Well, and the symptoms are the most important thing. So that's where I start. And then from there, the testing plan is made. And then I'm often asked, do we retest? And I have sort of two schools of thought on that. If somebody's getting the outcomes that they want and they're feeling better, then we don't always retest because it's not going to change anything about what I would recommend to them. So I want to know that the testing that we do is actually going to have a benefit and lead me in a certain direction. I don't want to test just to test
Yeah.
if it's not going to be informative for me and the client.
Yeah, that makes sense. So you choose the test based on their initial symptoms that they come to you with.
Mm-hmm.
And then if they start feeling better, then you don't necessarily retest because you got to your goal.
Right. And then if things start to go sideways in the future, then like I had somebody this week that was like, I think it's time to recheck because, X, Y, and Z is happening. So, okay, let's do it. So,
Awesome.
because unfortunately, as you know, hormones are a moving target. It's not like we take a snapshot and it stays the same. So, as my clients age, things begin to change again.
Yeah. So I love that it's a customized approach using functional medicine. But do you find any commonalities among the women as to what you tend to recommend for them and what types of hormone issues are usually at play?
Yeah, so my specific focus is perimenopause. And that I had a very specific reason for picking them because they don't generally need prescription products. Now, having said that, oral progesterone comes into play sometimes, and for that, they would. But my menopausal people tend to be more likely to need prescription estrogen or testosterone. And because I'm a pharmacist, I can't write those prescriptions without a collaborative practice agreement, which I don't have in the state anymore. But there is so much that can be accomplished in perimenopause with just lifestyle and supplement changes. And so that is why I really micro focused my niche on to perimenopause and then wrote a book. So that was really helpful too.
Oh, great. So I can include that in the show notes
Yes,
for more information.
it
Awesome.
is.
Love that title with the symbol. Okay, so what supplements or lifestyle changes would be your go-tos for perimenopausal women?
So first of all, stop drinking alcohol, possibly stop drinking caffeine, and get rid of sugar. And those are the three things that can make the biggest difference when it comes to nutrition. Eliminating gluten and dairy can be big for some people. So those are huge. And then sleeping. So most most of my clients will look at me and go, well, if I could sleep, I would. And I'm like, I understand, but you at least need to provide the container to get a decent night's sleep. So, going to bed at 1 a.m. and expecting to wake up feeling good at 6 is just not going to happen. But if you have that sort of 10 to 6 window when you can allow yourself to rest and wind down, that's very helpful. And then stress management is a huge component of what my clients need to focus on. So I have had recently clients with flatline cortisol, clients with it off the charts. It's all over the place. So we work a lot on that, and adaptogenic herbs and are very helpful for that, as well as vitamin B5 and vitamin C if the cortisol is really, really low. What else do I love? I like Vitex a lot for people who have progesterone to estrogen imbalance. That's very helpful, along with vitamin C. What else is in my toolbox? B vitamins, because stress depletes Bs. And if people are on birth control pills or hormone replacement, then their Bs are being depleted in the face of that as well. D and K2, another very common combination, and then magnesium, which has been my personal lifesaver, is something I recommend probably to almost everybody.
Awesome. So are most of those available as supplements,
Mm-hmm.
extracts, herbs, tinctures? How do you prefer to recommend those?
Uh, that is kind of up to the client. So some people don't like the way tinctures taste. So probably not going to go in that direction. But if they don't mind, I actually prefer liquids because I think they're better absorbed. It really just depends on, what I can access, the client preference. I've got a couple people I work with right now, that have a fear of swallowing pills. And so that presents its own set of challenges. But a lot of the products that I use come in powders, and so we're able to do that, or the tinctures. So it just is all over the map, really.
I like powders too because
Yeah.
dosage is so flexible, and again, it's better absorbed usually than a
Mm-hmm.
capsule. What about topical? Do you find a lot of women benefiting from topical applications?
Yep. So I do, there are some over-the-counter estrogen products that I have recommended in the past. I use topical progesterone a lot. I have also recommended vaginal products because that's a route of administration that we sometimes forget about. That's actually very good. So the
In
compound,
this case.
huh?
Especially in this case.
Yes.
Yeah.
So my people that can't swallow the progesterone capsules, if that's what their doctor has written for, those can be used vaginally. So yeah, there's just all kinds of ways to do things.
Awesome. So, what is the overall goal of a client that would work with you? Is it to decrease the symptoms of perimenopause?
Mm-hmm.
I don't know. Is it to increase quality of life? Like, what do you find is the usual goal that people come to you with?
They really just want to feel at home in their bodies again and feel like themselves. That's the most common thing that people will say to me is, I just want to feel like myself again. And usually what has happened in that case is they've stopped sleeping. So that, right out of the gate, that just completely interrupts that feeling of well-being when you can't get a good night's sleep. And then generally the other thing that's common is the progesterone and estrogen are out of balance. So we fix that. That takes care of hot flashes and night sweats. And then when they clean up their diet, they just feel so much better. So yeah, it's I want to feel like myself again. That's the main goal.
And what's your take on women that, let's say, have passed perimenopause and have gone into menopause? Do those women benefit from estrogen and progesterone balancing, or at that point, do you just kind of help them go into menopause without adding any extra hormones into the mix?
Well, again, it really depends on what they're experiencing. So everybody can benefit from cleaning up their lifestyle. So we definitely do that. Um, it is very possible, even in menopause, to still have a situation of estrogen dominance because we're exposed to so many compounds that look like estrogen from the environment, and because fat tissue makes its own estrogen. It's still not unusual to see the levels be low, but they still are out of balance with each other. And so those women can benefit from some supplementation with progesterone. And then if they've got issues like vaginal dryness, that responds well to vaginal estrogen. And there are a couple of over-the-counter products that I think are just that people have had great success with that aren't estrogen for vaginal dryness. So one of them's hyaluronic acid, and the other one is a combination of different herbals, and then it's got DHEA in it, which is the active ingredient, and it's called Julva, Gulva, and it was created by an OBGYN. So I've recommended that quite a bit. When it comes to hot flashes and things like joint pain, sometimes prescription estrogen is just the way to go to restore somebody's quality of life. And so, I spend a lot of time talking about the studies with estrogen and the risks and the benefits. And, people still, even though it's been 18 years since the Women's Health Initiative study came out, there's still that, that idea that estrogen causes cancer. And it's prevalent in the lay population, and it's still prevalent in the physician population. And so there's still this need to try to shift that thinking around. So because there's all kinds of confusion. It's just unbelievable.
So do you find that women can benefit from indefinite supplementation with progesterone and estrogen, or is there a limit to how much they could help?
Well, in 2017, they changed the guidelines. The North American Menopause Society changed their guidelines based on studies that had come out since the previous set, which you know what the date of that was. But now they recommend that you can continue hormone supplementation as long as it's needed for symptom control. And given that there's some data coming out about low estrogen and dementia risk, the positive effects of estrogen on bone health, on cardiovascular health, there's no longer this, oh, you can't take it any longer than 5 years thinking. So as long as you start it within 10 years of menopause or under the age of 60, you basically can continue it for as long as it's needed.
All right. Well, thank you so much for clarifying some of these questions. And also thank you for sharing your wisdom with us today. If you have just a few more minutes, I have some rapid fire questions for us.
Okay.
Okay. Number one, what is your advice for pharmacy students or pharmacists that want to also quit the 9-to-5 and start their own thing?
Do it. Don't expect to get it right out of the gate. And so I would also say find yourself a mentor who has done the thing, preferably somewhere in the area that you want to practice in, to help guide you. And I would also say, I know this is a rapid fire question, but it's getting long. um, to make sure that you try to narrow your focus of the population you want to work with down as much as you can, because you can't market to everybody. And if you try to, you just confuse people. So spend some time thinking about, who does it really light you up to work with? I don't want to do geriatrics. I'm very clear about that. I don't want to do pediatrics. I'm very clear about that. I really, really enjoy working with the age of women that are my clients.
Yeah, so it's like finding that ideal client,
Mm-hmm.
finding a specialty area that you can excel at.
Exactly.
Yeah, perfect. So number two, how can listeners improve their life right now? Like, what's the number one thing that they could do to start to see an improvement in quality of life?
In their professional quality of life?
No, just health in general.
Manage your stress. Put your life under a microscope and look at what you need to say no to, because you cannot say yes to everything, because you just end up completely stressed out. So leave some, what I call white space on your calendar, just for you to, just be. Don't try to do all the time. Spend some time being.
Yeah, I love that. And no could be very powerful because you're making space for what you actually want to do and say yes to.
Absolutely. When you say yes to something, you're saying no to yourself. And so there's a book called Take Time for Your Life by Cheryl Richardson. And in that book, she talks about the concept of making a list of your absolute yeses in your life, which should be no more than about 5 things. And I have found this to be a really, really helpful tool, because if something is not on your absolute yes list and it doesn't fit, then it's a no, and it makes saying no so much easier. And the more you say no, the easier it gets. So it's hard at first, especially if you've been used to saying yes to everything and trying to serve everybody but yourself.
Yeah,
So that's a great book that I recommend to people.
I love that. I've suffered from indecisiveness myself for a long time. So it's just like training that muscle that now you can define what is a yes, what is a no. And the more you practice that muscle, the clearer it will get.
Well, and sometimes it's not even about indecision. It's about trying to be a people pleaser. And, those are two very, very different things. But, it's about knowing yourself well enough to know, am I trying to please everybody? And you just can't. And
Yeah.
people take advantage of that. Once they identify you as somebody who always says yes, you are the first person they come to.
Yeah.
So,
Been guilty of that too.
yeah.
All right. What's your favorite pastime or hobby?
I like hiking in the mountains. I like cooking, and I like to play golf
Nice.
and read,
Love that.
hang out with my husband and my dog.
Very nice. Nature is our friends, and so are
Mm-hmm.
our animals and husbands too. Why not? All right. What is your favorite beverage to drink?
Do you really want to know? Red or white wine, and I'm not picky.
Yeah, it's a fun one. I love hearing the answers to these things. All right. Lastly, Dr. Annagarrett, please tell our audience how they can get in touch with you or learn more about your work, and what is your overall mission with your business?
So I can be reached at info@dr.annagarrett.com, or through my website, which is dr.annagarrett.com. We'll also have some links to, I have a private Facebook group. I've got all kinds of things. So we'll post some of those. And then what was the last question?
What is your mission of your business?
My mission is to help women in midlife rock their mojo through midlife and beyond.
I like it. Awesome. So yeah, we'll have those links posted. Thank you again so much for your time.
You're
And
welcome. Thanks for having me.
enjoy the rest of your day and your week.
Thank you. You too. Stay safe.
Take care.